The Alliance brings together a comprehensive partnership all across healthcare services, social care, local government and the voluntary sector.
Coming together of different organisations to consider how we can provide better health and care outcomes for the people that live within our community.
We do have very good relationships, and I think that's one of the beauties of being part of the North West Surrey Alliance. It brings all those elements together.
We know that we're a really strong local authority, we do amazing things for our residents, but what the Alliance enables us to do is really leverage quite a lot of that work. It means it gives us more influence.
Partnership working for us is so important in terms of delivering the right services for working residents.
Our work with the Alliance has strengthened ties between this council, the NHS and neighbourhood and neighbouring authorities. And we have learned from each other, providing our residents with improved healthcare.
Runnymede Borough Council has always held the ambition to support its residents with their health and well-being. However, it's the formation of the Alliance that really has given the chance for partners to come together to have a shared goal and objective in order to provide the best possible outcomes for residents.
We enable communities to stay healthier and people to stay healthier for longer, but also bring the services together so that when they do have problems, they're far more integrated.
It's a real opportunity for health and care to work collaboratively together for the benefits of our residents, working in a way that enables residents to tell their story once to the professional that's looking after them without having to duplicate and tell their story multiple times.
And I think again it plays back into why the Alliance is important, because it means we can feed in that view of local residents and make sure health colleagues understand what local people think and what local people need in terms of services.
The Alliance is already doing some amazing work. We're bringing physiotherapy services out into local leisure centres and into local communities.
Today we're here at the Egham Orbit Leisure Centre where we run the LEGA class, which is the lower limb education group. It basically gives people that have knee problems, ankle problems, hip problems, information about how to deal with their pain, how to manage kind of an overall healthy lifestyle. And then we do an exercise component which works on kind of balance, function and strengthening as well.
We're revolutionising dermatology services, bringing in new technology and artificial intelligence to give people quicker access to cancer care.
We have a new AI version of the Photo Hub now, and we use a platform called Skin Analytics. So the new system means that when the GP makes a referral, they can opt to have the patient come to the Photo Hub. The patient comes into us within 2 working days. We take a series of images that are uploaded, and the patient is then triaged on the basis of those images. They are looking at those patient cases on the same day, and they're turning them around the same day, which is phenomenal, really.
Rapid Response is now known as the Urgent Community Response Team. We've now developed 3 different pathways: the 2-hour response, 48-hour response and the 7-day response. We provide wraparound or short-term packages of care. So if a patient is struggling with their personal care or meals/medication, our aim is to avoid hospital admission through promoting safety and independence. From my experience, patients have really found the service helpful in terms of having the most appropriate mobility aids, equipment and provision of care to help them be safe, promote independence at home and to help avoid hospital admission.
It's giving you confidence all round. This is a wonderful course. It really is.
The step down service came about because Speltham Borough Council had identified that there was a need to support the hospital. So whilst working with partners and coming together with the Alliance, they decided to look at an option where there was a temporary accommodation for people who were remaining in hospital for extended periods of time because their home or their destination was not suitable to be able to meet their current needs.
It was a lifeline, just as literally for him to go somewhere, be able to be by himself. It's a nice place to be, to set you off, get into your own home again.
I'm more than happy to be here. I think this was ideal, my situation at the time.
Across North West Surrey, what we're trying to do is bring organisations together to work in a more integrated way to support people and provide them with wraparound personalised care.
How staff can learn from colleagues in the district and borough councils, can work with GPs, can work with our community health provider.
For our teams, I think it will be an excellent way of actually bringing us together, looking at how we work more cross-functionally, actually learning from each other, and possibly even swapping roles so we get greater experience. So I think it's a huge opportunity both for our citizens and for the people working right across the whole of the Alliance.
So what does the Alliance mean to you and your family? We aim to deliver much more integrated, joined up services, providing the right support at the right time. We bring together a different mixture of expertise all across organisations that allow us to provide much more complex care and much more responsive assistance for people.
We're able to give you the care that you need in a local facility that is agile and provides the care that you need when you need it.
And we'll aim to make things easier to access, with simpler ways to book an appointment without bouncing between organisations and different services. So the Alliance is an incredibly exciting opportunity to deliver more value to local people, to improve outcomes for you and your family, and to deliver benefits and new opportunities for our staff all across the partnership.